Dr. Kristin Lasseter. She is a reproductive psychiatrist with the Reproductive Psychiatry Clinic of Austin in Austin, Texas. And I want to, there's so much, and I actually put an Instagram post asking about questions, and the questions are excellent, but there's no way we can cover everything. So what I want to focus on today is specifically medications, psychiatric medications during pregnancy, for those who either are on them preconceptionally and then are planning to get pregnant, or they happen to find out they're pregnant while they're on medications, or they need to start them while pregnant. So we can come back at another time and talk about breastfeeding while undergoing infertility treatments and things like that. We just don't, I want to dedicate the time specifically today to pregnancy. Is that okay with you?
Yeah, that sounds great.
Okay. And reproductive psychiatrist, explain to those that are listening, what exactly does that mean?
So basically, it is a psychiatrist who specializes in mental illness related to changes in reproductive hormones. So changes with estrogen, progesterone, around your menstrual cycle, of course, when you get pregnant, postpartum, menopause, all those fun times that we get to experience.
So to get to do reproductive psychiatry, you go through the years of residency training in psychiatry, and then do you subspecialize?
You can. So you can do a fellowship in reproductive psychiatry, or they have like women's mental health fellowships, or you can get extra training while you're in residency and do specialized like tracks of women's mental health, so that you can go about it different ways.
And then how could someone go about finding someone that does specifically what you do? And, so psychiatry is great and all that, but if someone's looking specifically for someone that does what you do with the reproductive psychiatry, how can they go about finding someone in their area that does exactly what you do?
So with reproductive psychiatry, I think it's a little bit hard. There's not like one main place where you can look up and find a reproductive psychiatrist, but with perinatal psychiatrists, so psychiatrists who specifically specialize in pregnancy and postpartum, you can go to Postpartum Support International's website, and they have a directory where you can look up, psychiatrists who specialize in specifically pregnancy and postpartum. And then there's lots of other websites or directories that are out there. I can't name them all, but that one's probably the biggest and most well-known one.
Yeah, and I was just talking about that site with someone the other day. So it is a very helpful site to give you information to find, certain people that specialize more in those that need treatment, therapy, medications around pregnancy, preconception, postpartum. So that's a good place to start as Postpartum Support International.